Welcome to the Health and Wellness Show. This is Paul Hambleton. Today we're going to be talking about TMJ disorders, headaches and other types of pain, as well as stress. We're going to talk to an osteopathic manual practitioner about this. Today we have Jared Postance with us. Welcome to the show.
Thank you.
I'm glad you could join us today. Just to start off, before we get into the topics I just mentioned, could you tell us a little bit about your area of expertise and how that differs from a chiropractic approach?
As you mentioned earlier, Paul, I'm what's called an osteopathic manual practitioner, and that involves a serious study of anatomy and physiology and then osteopathic approaches to manual correction. And so my areas of expertise is anything that has to do with the human body. We study every aspect of anatomy and every piece of physiology so we can understand the structure and function and relationship of the human body. And how this differs from chiropractic approach, I'm not too sure. I've never been to chiropractic college. I've never had a chiropractic treatment done. But I understand there's some differences in terms of how we approach treatment. We don't use any modalities. We use our hands. It's a palpatory type of skill. It's a very gentle approach. We use the finger pads to kind of sensory reception to the tissue so that we can understand how the nerves functioning, how the blood supply is going, and we do everything is very gentle. Our treatment also lasts probably the 20 to 40 minute mark, but 40 minutes is probably a lot. It's kind of an area where you're getting into the point of over-treatment. So we just generally treat in the 20 to 30 minute range, and that's usually enough to kind of get things going, and we work on things in stages. So we see patients anywhere from every other day to once a week to once a month, depending on where they are with their symptoms.
Terrific. That's a great overview. Thank you very much. Now I'm curious, how did you get started in your field in the first place?
That's a great question. I've always been an avid exerciser and was involved in a number of sports over the years. I played football, and then I went in to play rugby for a number of years, and then finished that up with playing for Team Canada for Australian rules football. So over those years of playing these different very contact and collision-based sports, I suffered a lot of minor injuries and major injuries. So a colleague of mine who was an orthopedic therapist and also was finishing up his studying in osteopathic work, did some treatments on me for concussions. And so I was just amazed at what he was able to feel and do, and the conversations we were able to have based on my background, my educational background, and how someone could actually treat cerebral spinal fluid, how they could treat the nerves, how they could treat an organ through just manual technique. So it just piqued my interest in the subject to the point that I just had to go on and continue furthering my education with this type of a field.
So after your initial interest was piqued, what type of education did you need to take to get to the point where you're at now?
There's been a lot of education in my background. I spent 4 years at Queen's University doing a Bachelor of Phys Ed and then a Bachelor of Arts in Health. So it was quite a foundation built there with physical health education as well as focusing on different avenues in health and psychology and sociology and different subjects like that. Then I went on to York University and did a certificate in athletic therapy. So there we focused on sports injury specific and how the injury process was happening during different types of sports, as well as the inflammatory reaction and more anatomy, more physiology specific to sports injuries. And then I followed that up with 4 years I spent at the Canadian Academy of Osteopathy. And during that time, I spent another 3-4 years just concentrated on anatomy and physiology and palpation and manual therapy. And finished doing a master's thesis on autoimmune diseases.
Wow, that's a lot of training. So at this point in your clinic, what type of services do you provide?
Our clinic is very, very unique and very specialized here in the city of Toronto. We have a clinic that's just mostly osteopaths. There's about 6 or 7 of us working here now, specialized just in osteopathic work. And then we've also brought in a couple of naturopathic doctors because the two professions seem to be very synergistic in terms of their approach, their philosophies and where they see how the body reacts and acts in this environment.
What would some of the most common symptoms be then of the patients that you see in the practice?
Well, you see, most people don't know what osteopathy is, and they come to us based on a referral system. And usually they approach us from some sort of orthopedic pain scenario or something that's been built on from repetitive strain, stress kind of thing. And that's not what osteopathy is meant to be. Osteopathy is meant to be both palliative, corrective, and preventative. So it can assist with all kinds of things, but the most common thing people come to us is pain of some sort, and then we have to kind of be a sleuth about this and figure out where is this pain coming from, because it's not about the symptom to us, it's about the root. Where's the cause? What is the cause of the causes? And find out and trace back through time and find out where in history did this event occur and kind of brought the patient to the point. In addition to that, I think the most common denominator of most people that we see on our table is some element of stress, and that can be from an internal stress, from an emotional standpoint, and what they're dealing with in their personal life and their professional life. It also can be from their structure, because the nerves in their body are dictating the amount of stress that we perceive in our body, whether it's through release of more hormone called cortisol or the suppression of the parasympathetic nervous system. So pain and stress are probably the two that we would see as a common symptom.
So headaches would be a type of pain, and I know a lot of people these days have headaches. What's some of the different types of headaches a person might experience?
Well, headaches are a very interesting thing. We do see a lot of patients with headaches. They can come from a wide variety of different causes. It could come from something like a car accident that brought on some sort of traumatic element to the entire spine structure, creating a hypo versus a hyper mobility aspect where one is moving, one is not moving, and that's creating kind of a dysfunction in the overall movement of the bones within the head, neck, and the upper thorax. It can be from some sort of compressional element on blood supply in and out of the head. It can be from a change in cerebrospinal fluids, pressure in around the skull with the fluid that provides nutrients to both the nerves and the brain. It can be from pressure-based things on the scalp itself, like something may have happened during the childbirthing process where the skull bones may have been kind of manipulated or adjusted during that process, whether it was forceps or vacuum-based deliveries. So we can see a wide variety based on pressure or mechanical change or fluid mechanic issues, all kinds of different types of headaches.
So what about the misalignment of the spine? Can that play a role in the headaches or the migraines in the patients that you see?
It's definitely a major portion of what happens, because in osteopathy we agree that structure and function are interrelated at all levels. So if we look at the anatomical skeleton and we know a theoretical norm, how the center of gravity is supposed to be traveling down through the body from the skull down towards the feet, there are curves and arches that are present in the spine, and they should be within a certain degree of norm. If they're deviated in any different degree, then it changes how fluid passes in our body. If we think that from our head to our feet, we're basically a series of tubes, whether it's the digestive system, whether it's the spinal cord, whether it's the arterial supply, whether it's the lymphatic system, all these are tubes of fluid. And as the bone structure changes and deviates off its theoretical norm, then it changes the efficiency of which that fluid can pass down through the body and return. So a supply and drainage type of thing. And that can be a major component of this. So we start from the pelvis as the foundation of the body, check to see how the innominate bones or the hip bones are interacting with the tailbone or sacrum, and how does that interrelate with the rest of the spine, up through the lower back, and the mid back, and into the neck, and the head bones as well. So how are they all influencing each other, impeding the proper flow of the fluid that's going on to the body, and how is that causing pressure or strain or various different tensions through the body?
It's very comprehensive then, as you just discussed. So I'm wondering how headaches might be related or connected to other symptoms that are related to that condition.
Yeah, so as we go through the initial the appointment, the case history of the patient, we learn lots of information about the patient. What kind of surgeries they've had, what kind of injuries they've sustained, what kind of diseases they've had, what kind of medications they're on, and all of these come into give us a larger picture of what is that appearing in front of us. So as the patient is standing there, and we're looking at their structure and we're feeling their motion mechanics, how is all this influence what I see in front of us? Are they bent over too much? Are they slouching to the left? Can they move only left, but they can't move to the right? And so the whole entire history of the patient from day one until when we see them in the office gives us an idea of what all the things are, the total collaboration of things that have influenced this person that we're standing in front of with their specific symptoms. So each patient is unique. There's not two patients. Like, you could have 10 patients walk in your office all telling you that they have a headache, and there's not one course of treatment that's going to be the same. You have to have the treatment that's specific to that patient. It might be a correction of something in their tailbone that would help take tension off their head. It might be something in the collarbone or the upper ribs that may take pressure off the blood supply up into the head. So every single patient is different. We have to look at it as a living organism with a unique set of complications that brought on the symptoms.
So you mentioned the collarbone there, and we're talking about headaches. I'm wondering what the relationship is, as you see it, between the TMJ, which is obviously the temporomandibular joint, and the head, the shoulder, the neck, the hip. Can you talk a little bit about the relationship between all those areas?
Of course. So we look at talking about upper girdle versus lower girdle. We kind of look at things in that perspective from what's happening at the fourth thoracic vertebrae and above. So generally speaking, everything that's moving from the fourth thoracic vertebrae up to the head is what we would consider in the upper girdle. So the ribs, the collarbone, the cervical vertebrae, the bones of the skull, the mandible, which you're talking about the temporomandibular joint. So if you have, say we take the thing of a whiplash scenario, we're having a head that's flexing and rotating on an axis that's kind of enforced by a trauma that's been introduced to the body. And your D4, your thoracic 4, is a pivot point, and everything's spinning off it, and so it creates a hypomobility, and a spot of non-movement, and then the rest becomes hyper up through the spine, and it could be different segments. The impact point might be at C3, it might be at C7. We'd have to work on each individual person to find out where that is, but sometimes as that force goes up into the skull, it also creates a hypomobile segment in the OA joint, which is the occipital-lantal joint, the first segment where the skull meets the cervical area. And that also influences the temporal bone, the parietal bones, and the mandible. So all those bones can have an alteration in their motion because the suture lines have membranous tissue that lines between them, and it's organic, and it kind of expands and contracts with the fluctuation of cerebrospinal fluid in and out of the brain. And people can have, the bones itself can kind of just get off track a little bit at the temporomandibular joint, creating the dysfunction, which is TMJD. And all you have to do is try to assess where all the points of lesioning is. We call anything that's an alteration in mechanics a lesion, and correct those things leading up until possibly the parietal bones or the TMJ or any of the other bones in the head and neck. And most of the time, we're trying to decompress and compress and various different types of things to kind of free up that so it goes back to its natural free-flowing motion and movement.
So looking further at some of these contributing factors, I'm wondering how stress might play a role in the various symptoms that you've discussed.
Stress is a major player. So most people know this is called the fight-flight response kind of thing. But it's such a generic version of that, and it's basically the fight-flight is based on what's called the sympathetic nervous system in our spine. And that runs down the posterior aspect of our spine adjacent to the vertebrae, which means that any alteration in the change in the vertebrae can have an influence or an effect on the actual sympathetic nervous system. Now, the sympathetic nervous system also works in conjunction with our adrenal glands and cortisol. So we talk about what's called the HPA axis, the hypothalamus, pituitary, thyroid, and adrenal axis, and how those hormones are interacting with each other throughout the day to kind of regulate how we work. So hypothalamus, pituitary, they are important in organizing and being the control center of all the hormones. But if the cortisol comes into play. It can be a very powerful agent at driving our body to levels of stress that we just can't function right. So that gives an area of dysfunction within that endocrine system. And that can also have an overlying effect because it's, I guess, synergistic hormone, serotonin, melatonin, which are the hormones that allow us to sleep, allows us to rejuvenate, to regenerate, to sleep, to rest, to all those things heal. They don't get to be active until we actually go to bed, right? Because if the cortisols are flying throughout the day, then we can't actually properly wind down. We have to have this fluctuation throughout the day where we're being excited to kind of get up and go to work, and then we need to have some time when we eat our lunch and we kind of calm down a bit so we can take a lunch break, kind of let our hormones settle down, let serotonin kind of wind in there a little bit, settle cortisol down a little bit, and then that cortisol will do a little bit more in the afternoon so we can continue on. So there has to be this kind of little bit of fluctuation and give and take back and forth from those two hormones. Most of us are driving this sympathetic nervous system, the fight-flight response, cortisol levels high, and it's not allowing our bodies to heal. So that kind of system just drives pain through over 10, 20, 30 years. It drives it further and further into a maximal level that people come into the office and kind of do. So we talk about trying to use the cranial nerves and the sacral nerves, which are part of the parasympathetic nervous system, and using the body's own capability of resting by focusing on sleeping patterns and circadian rhythms and that kind of stuff to calm the person down, take them out of the stress level, take them out of the pain, get rid of the headaches, and move on to normal, nice, comfortable living.
Well, you know, you talked a little bit about, at the beginning, about your approach with using your hands, the palpatory approach, and the finger pads. So I'm wondering if you could describe then a little bit more about your treatment approach for the symptoms that you've discussed.
Sure. So we're looking for, our overall vision of what we're looking for in a patient is anything that falls into a lesion. And that can be something that has an alteration in its normal mechanics. If the tissue is on tension, there's only two reasons that a muscular tissue went on tension. One, well, there's multiple others, but we'll talk about these two in kind of major players. One, because it's a voluntary contractile piece of tissue, you told it to do it. You picked up your pen, you moved your arm to say hello, whatever it may be, you told that muscle to do it. The other reason why muscular tension is there is because there's a structural dysfunction. There's a change in the normal mechanics of the body, and that's leading to a contracture, and that usually puts compression on top of what's called a neurovascular bundle. The muscles and the neurovascular bundles, they kind of are either bound each other. The neurovascular bundle could go through the tissue, it could go behind the tissue. So if you have this contraction of the tissue, then you can have an alteration in the efficiency of fluid exchange, neurological control, and drainage of the system. So what we do is we look for different strains and stress patterns, but we also look for changes in mechanical movement. We're trying to be experts in how does this joint move based on all the articulations of the joint? How does this bone interact with that bone? How are they supposed to move? How are they supposed to pivot together? What axis of rotation are they on? There's 3 planes of motion. There's 3 axes of rotation. Is it off on this degree but not on that one? Usually one would always kind of make sure that there was a change in the other 3. So we look for other things too, like how does the skin look? Is there a venous congestion in the skin? Is there a fluid bogginess in the skin, which would indicate that there's some sort of swelling or fluid congestion in the area? So these are all things that we look for in congestion. So our fingers, we use them as kind of like sensors to find out, oh, well, that tissue's on tension, and why? Oh, this bone is not moving, so let's just gently try to coax it or tease it back into place to take that tissue off, whether it's a ligament or a tendon or a muscle. Let's try and see how much blood flow is going to an area based on the temperature of the skin or the pulse rate of the nerve or the artery. What's happening in terms of the color of the skin. So we can see all these things kind of momentarily as they're happening during the treatment.
So most people, I guess, like you said, they come in to see you for, acute problem, whether or not it's a certain type of pain, headaches, for example. But I guess one of their major goals, as well as yours on their behalf, is for them to move on to more overall wellness. So I was wondering how your treatment approach then can help, create overall wellness in the patient.
Oh, that's a good question. So in osteopathy, we believe there's a mind-body-spirit connection. And in order to create what we call overall wellness, you have to have a balance in all three of those aspects. You cannot be someone that eats well, exercises, sleeps well, and then goes down the street and kicks a dog and consider yourself to be well. You have to be well-rounded in all the three spokes. You have to have a balance in your spirituality, whatever that may be. You have to have an emotional and a social kind of balance to create the mental aspect of it, and you have to have a physical balance. If you're visiting a spiritual center constantly, but you're neglecting your sleep, neglecting your nutritional intake, neglecting your exercise, you're also not a well person. Wellness is the collaboration of the three, and osteopathy respects that because osteopathy is based on nature's law. And so what we try to do is not only just help the person's initial acute pain syndromes, but also talk to them about areas in which they can achieve better wellness through different things. Maybe it is a vacation they need to go on. Maybe it is more sleep they need. Maybe it is they need to find some spiritual connectiveness in some manner. But we have discussions with them about that. And what we do in osteopathy is we try to, we're looking for a correction to help the person remove the symptoms that they have at the current time and hope that it will never come back. We try to integrate and stabilize the structures that have been obstructed or put some sort of strain or stress on them. We try to correct them and stabilize them and integrate them back into the neurological system so that they don't become unstable again or become a weak link, become a future problem. Very rarely do we try to be palliative in our treatment. We try to be more corrective. We try to make a change in the patient each time. They're an onion. We try to peel off a layer, make a correction again, peel off another layer, and go from there. And sometimes that type of philosophy of treatment is more preventative, that patients won't find things in the future. They won't have, maybe an appendicitis in the future. They may not have an irritable bowel syndrome. They may not have asthma symptoms as strong as they normally have. They may not have. These are all kind of just predictions because we don't really know if we make a correction to a certain structure, relieve the nerve irritation to the area, help the blood supply there, improve the lymphatic drainage to the area, the venous drainage from the area. We don't know what the future would have held for that patient if we would have left that thing alone. We don't have only predictions on it. So that's where the wellness is, that we're just trying to make this thing a big picture. See them that it's not just about this individual incident. It's more about the whole living of your whole life. It's trying to have a better quality of life.
And when you take into effect, or into account, not just the physical, but the mental and emotional, for example, as you just mentioned, that really opens it up to how powerful it is to look at this from an individualized approach. Every patient that comes in, even though they may have the same symptoms, you're looking at the individual circumstances on the mental, emotional, physical, and all these other dimensions with that person to provide the best care that you can, both for the acute situation as well as for the long-term wellness. So
that's very correct. We have conversations with patients about their environment they're in. So, a patient may have dependents in their home that shouldn't be in their home, like children that are, that are taking advantage of them financially or taking advantage of them with some sort of abuse. Well, the lesion which we're talking about may not ever disappear because there's always that factor that we haven't changed. So if someone fell off their bike and fell on their shoulder, that's a one-time incident. We can help them with the correction of the ribs and the shoulder blade and the neck and the back and all that stuff, and can help with realign that, put back in place. But if we're talking about something that someone's in a depressed state because they're at home getting yelled at, or they're in an office in a dark environment with poorly lit room or mold in the room, we have to talk to them about removing them from that environment to help them heal.
So what would a couple tips be for people, if they're looking to understand more about headaches, for example, and the other symptoms that we've talked about here today in terms of stress and TMJ disorders and so on. What would a couple of tips be for people to understand more about this from your perspective?
I would say that people need to take a larger degree of what would be the right word to use in this situation? They need to start looking at their body as something that's going to take them to the end of this place, and they want to have the best quality of life throughout this entire journey. Most people will take their car into see their mechanic more often than they'll take their body in to see a professional for some treatment, because they think, well, my car's working, I can go get my groceries. If my car's working, then I can go to work and I can provide financial means for my family. But if their body's not working, they can't do any of those things anyway. So they have to take responsibility for how their body is functioning. There's not one practitioner out there that I know of that could be the sole change in their life. We can be contributors to their lives, but they have to take the reins by the horn, or the bull by the horns kind of thing themselves. Yeah. And say, I'm going to be the guiding of this. I'm going to look at my nutrition. I'm going to look at my exercise. I'm going to look at my sleeping patterns. I'm going to look at my working environment. I'm going to look at whether I'm taking all these medications or not. I'm going to look at whether it's better for me to figure out an alternative medicine to the surgery. I'm going to look at if it's going to be in my best interest to go get some treatment even though my body's feeling okay. I just wanted to get it to a better place so that I don't have something happen to me in the future. So they have to be the guiding force in this and use us practitioners and our expertise to assist them in that. And there's lots of patients that come in and they just dump it all on us and they want the answer from us. And the tip is they have to be responsible and be the driving force of their own quality of life. And if they're not ready to do that, then they have to talk to several practitioners. It may not be just simply an osteopath. It may not simply be a psychiatrist. It may not simply be a naturopath. They are the one that's going to kind of dictate whether or not their quality of life is there.
If somebody wanted to take the next step and they're looking to visit an osteopath, then somebody who does, osteopath manual, adjustments here, what should they know? What should they look for?
They should ask questions, and I think that's the same with any consumer thing out there. You shouldn't just walk into a place. If you're going to randomly do it like that, you should be asking questions. The referral system is always the best. Someone may know more about a certain subject. Well, where did you go to find those bricks for your house? Oh, I went over here. Well, who did you go to get some assistance for your body? Oh, I went to see this person. Well, what do they know? Where did they go to school? Where were they trained? How long were they trained for? In our industry, in osteopathy, there's a wide variety of osteopaths out there, just like probably every industry. And you have to ask these questions. Are you the practitioner that's best for me? What's your philosophy on health and wellness? Where did you go to school? How long was that schooling? How long have you been practicing for? What other things did you do prior to this? What is your life like? Because if I'm in a state of illness or lack of wellness, am I going to be beneficial to my patients? So I have to also show that I'm doing things in the right manner as well. So being informed, and this is always the case, knowledge is power, being informed about things is important. Also, osteopathy is not a thing that can be covered by OHIP, so that should be something that someone should know, that they're going to be coming in and they're going to be paying either from their own pockets because they believe in this, or they may have insurance plans. Most osteopaths and osteopaths that are licensed in Canada and licensed in Ontario will be registered with an association, and we'll have all insurance companies will have their name down with their registration number. They should be able to provide you with a receipt that says, this is my registration number, this is the association I'm registered with, and prove that you've done this. The World Health Organization has set out benchmarks for standards on osteopathic treatment that are now international. There are some schools that do follow those principles, which is great to see, and the consumer needs to be aware that they need to talk to people and find out where did you do your training, how long you've been training for, are you actually licensed, and use kind of some common sense when it comes to that.
Well, Jared, I'd like to thank you very much for your time today. You know, you've provided a great amount of detail and insight into your approach and how you can help people with a wide range of conditions, obviously. If people want to get in touch with you, what's the best way they can do that?
Well, they can certainly email me. It's at info at paths, P-A-T-H-S, the number 2, vitality.com. The number 2 there is to indicate that we have naturopathic doctors and osteopaths working here, so it's paths2vitality.com. The phone number here at the office is 647-352-5527. And they can also find out some more information about osteopathy if they want to do that before they make an appointment. Book something at our website, which is www.paths2vitality.com. And in that case, it is actually the letters, so T-O, Paths2Vitality.
Great. Thank you very much, Jared. Once again, thanks for being on the show.
Thank you very much. It's been an honor and a great pleasure to be here.
Thanks again. Bye-bye.